Hello, I am Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. With me today is NFID Medical Director, Dr. William Schaffner, to talk with us about Keep Up the Rates, a new campaign that NFID is launching to encourage all individuals to receive recommended vaccines that may have been delayed due to the COVID-19 pandemic. Thanks for joining us, Bill.
Good to be with you, Marla, always.
So, why are immunization rates among all age groups declining during the pandemic, and why is this a cause for concern?
Well, as you know, people have been sheltering in place, so they haven't been going out for their routine medical care. And indeed, we have advanced telemedicine now to the point that lots of practitioners and indeed lots of patients have become used to it. So you can sit on your proverbial couch and interact with your physician or other healthcare provider. Well, it's not so easy to vaccinate via telemedicine. So what's happened is that immunization rates among children, routine vaccines, and also the vaccines that we try to give to adults, those vaccinations have diminished very, very substantially during this telemedicine COVID-19 period. So we're all trying now to catch up and keep up our rates of vaccination. We're trying to get children back to their pediatricians and family doctors, and adults back to their healthcare providers, their pharmacists, to make sure that their immunizations are caught up and we keep up the rates of immunization. Otherwise, we'll have the return of those bad vaccine preventable diseases.
Indeed. So as a parent myself, I know that parents have a lot on their minds these days, including whether or not to take their children to the doctor's office for well visits. So what should parents be considering as they make decisions on whether or not to vaccinate their children and whether or not to send them back to school during the pandemic?
So communicate with your provider, email, telephone, and every provider is now figuring out how to provide vaccines very, very efficiently and quickly. Indeed, some pediatricians, and I understand even some internists, where parking is right next to their offices, are actually having their staff come out and vaccinate people in their cars. That's an innovation for sure. Some of them are scheduling quick in and out vaccinations at the beginning of the day or at the end of the day. In any event, they're doing things to make vaccinations quick, easy, and most importantly, safe.
Perfect. So why is NFID launching this Keep Up the Rates campaign? What do they hope to accomplish?
Well, we were all launching this campaign because, among other things, all these diminished vaccinations, we have to catch up. So we have to energize our providers. I think they're pretty energized already, but we're going to give them a booster dose of energy, and also communicate to the general public that you can get vaccinated safely. And we're doing this starting out during National Adult Immunization Month. And also, you know, we're about to start vaccinating against influenza. And of course, that's going to be important routinely, but especially important given that we anticipate a double-barreled winter respiratory virus season, both influenza and, goodness, COVID also.
Sounds ominous. So what role specifically can healthcare professionals play to help keep up the rates?
Well, obviously, they can do some of the things that we've talked about already, namely getting their whole office staff to think about how they can provide immunizations very efficiently, quickly, and safely. And then they can try to communicate that to their patients and encourage them to come in for their routine vaccinations. And many providers do this in any case during influenza season, setting up special immunization clinics or times during their practice where people can come in very quickly and get vaccinated. Some do it, as I said, at the beginning of the day, others doing it at the end of the day, but an in and out vaccination is something that I think a lot of people would find attractive.
Absolutely. So are there any other specific best practices you wish to share for addressing these challenges associated with immunizing during the COVID pandemic, either for, patients and parents or for providers themselves?
Well, I think the first thing is attitudinal. Let's recognize that we've diminished our routine immunizations. We don't want this gap to continue because we can then have more infectious diseases affecting us as patients. So I think, first of all, being determined, getting it in our minds that it's okay to get vaccinated, that encounter with the healthcare system is going to be safe in this COVID environment. And then as providers, I think we need to think about each of us in our own specific circumstance, whether we're pharmacists, in a senior citizen center, in an occupational circumstance, in a multi-specialty physician's clinic, whatever. We need to think about ways to administer vaccines quickly, safely, and with the encouragement of the provider. And I'll get in a plug for flu because we're about to enter flu vaccination season. It's always important, but as I like to quip, don't be a flu vaccine recommender, be a flu vaccine insister, and try to engage with your patients who are cautious about influenza. Remind them this year it's more important than ever.
Well said, as always. Bill, thanks again. Always a pleasure to talk with you. I really appreciate your insights, and thank you all for joining us for today's edition of the Schaffner Report. Have a good day.
Best wishes. Thank you, and best wishes to all. Stay safe, everybody.